Interpreting breast cancer index, or BCI test reports is straightforward. The full 0 to 10-year report is organized into 2 pages of results. Page 1, titled Results to Inform Adjuvant Therapy, is exclusive to the full 0 to 10-year report and provides a prognostic result that reflects a patient's risk of distant recurrence in years 0 to 10 post-diagnosis. Page 2, titled Results to Inform Extended Endocrine Therapy, reports results applicable if the patient completes 5 years of endocrine therapy and remains distant recurrence-free. Results mirror the traditional BCI test report and include a predictive result, a clear yes or no indicating whether the patient is likely to benefit from extended endocrine therapy, and a prognostic result, which shows her individual risk of late distant recurrence in years 5 to 10, illustrated as a comparison between stopping at year 5 versus continuing to year 10. Note that this page is consistent with the single-paged 5 to 10-year report. Together, these 2 pages of results help providers set clear expectations around endocrine therapy duration for postmenopausal patients: 10 years, 5 years, or potentially even less. In this first example, page 1, which reports results to inform adjuvant therapy, shows the patient's risk of 10-year distant recurrence is less than 5%, even without adjuvant endocrine therapy. This result represents the average risk of patients in the minimal risk group from the Netherlands Cancer Registry, or NCR, study. As noted, these patients may be considered candidates for omission or a shorter duration of endocrine therapy if clinically indicated. Note that this minimal risk result for 10-year recurrence risk without adjuvant endocrine therapy will only arise for node-negative patients. On page 2, results to inform extended endocrine therapy will continue to be included with every report. This may be applicable even for patients at minimal risk of 10-year distant recurrence if the patient is particularly risk-averse and still completes a full 5 years of endocrine therapy and remains distant recurrence-free. If the predictive result indicates no, the patient is not likely to benefit from extended endocrine therapy. Continuing treatment beyond 5 years is not likely to further reduce the patient's risk of recurrence. However, if the predictive result indicates yes, the patient is likely to benefit from extended endocrine therapy. A full 10 years of endocrine therapy may help reduce recurrence risk even further. This type of result highlights the need for shared decision-making based on a patient's individual risk tolerance. In the next example, postmenopausal patients who are not classified as minimal risk receive an individualized 10-year distant recurrence risk based on completion of 5 years of adjuvant endocrine therapy derived from the team reference study. For node-positive patients, while the full 0 to 10-year report may be ordered for patients with up to 3 positive nodes, the 10-year recurrence risk for node-positive patients will always be based on treatment with at least 5 total years of endocrine therapy. Tumor size and grade are also factored in to further refine that estimate. As noted on the report, at least 5 years of adjuvant endocrine therapy should be considered for these patients, and additional results to support extended endocrine therapy recommendations may be found on page 2. As reviewed earlier, page 2 will include results to help inform recommendations around 5 versus 10 years of endocrine therapy. For patients identified as yes, likely to benefit from extended endocrine therapy, risk of late distant recurrence in the 5 to 10-year window may be reduced by approximately 58 to 67% when treatment is extended to 10 years versus stopping at year 5. This is reflected in the prognostic results section, where we see risk of late recurrence with 5 total years of endocrine therapy and the reduced risk of late recurrence with 10 total years of adjuvant endocrine therapy. Alternatively, patients identified as no, not likely to benefit from extended endocrine therapy, experienced no significant risk reduction from continuing treatment beyond year 5. So regardless of whether the patient continues to year 10 or stops at year 5, the risk of late recurrence will remain approximately the same. For a premenopausal patient, the BCI full 0 to 10 year report helps personalize two key treatment decisions. First, the potential omission of ovarian function suppression, or OFS, to primary adjuvant endocrine therapy. And second, the appropriate duration of endocrine therapy, 5 or 10 years. In this first example, page 1 shows results to help inform adjuvant therapy by reporting risk of overall 10-year distant recurrence. A premenopausal, node-negative patient identified as having minimal risk has a less than 5% risk of 10-year distant recurrence without the addition of OFS. This is based on the SOFT study in patients who received tamoxifen alone without the addition of OFS. As noted on the report, patients with this result may be considered candidates for omission of OFS if clinically indicated. It is important to note that this minimal risk result applies only to node-negative patients who receive 5 years of adjuvant endocrine therapy. It is also important to note that unlike the full 0 to 10 year report for postmenopausal women, for premenopausal women, results are always based on a 5-year backbone of adjuvant endocrine therapy and are intended to inform potential omission of OFS, not omission or shorter duration of adjuvant endocrine therapy. A premenopausal patient, identified as non-minimal risk, receives an individualized recurrence risk estimate based on the SOFT study, which included both patients who received OFS and those who did not. As indicated on the report, the addition of OFS to adjuvant endocrine therapy may be considered for these patients, and results to inform extended endocrine therapy may be found on page 2. Risk of 10-year distant recurrence for node-positive N1 patients will always be based on a cohort including patients who both received OFS and those who did not. Regardless of whether the patient is at minimal risk or not, as described in both premenopausal examples, page 2 will continue to report results to inform extended endocrine therapy. Patients identified as yes, likely to benefit from extended endocrine therapy, may reduce their risk of late distant recurrence by 58 to 67% with a full 10 years of endocrine therapy, compared to those identified as no, not likely to benefit, whose risk of late distant recurrence is likely to remain approximately the same regardless of 5 versus 10 years of endocrine therapy. For premenopausal patients, refined risk estimates are based on validation in the landmark SOFT and TEXT studies. These examples highlight how interpreting both pages of the full 0 to 10 year test report helps providers set clear treatment plans from the beginning, using personalized results to gain comfort in de-escalating treatment recommendations to avoid unnecessary side effects and toxicity, or gain patient commitment to treatment plan adherence. Leveraging BCI test results can help you make informed, personalized decisions for your patients to set clear expectations about the next phase of treatment, endocrine therapy. For any questions regarding how to interpret the Breast Cancer Index test results, contact your oncology account executive or the Biotheranostics client services team.